Hi, this is Dr. Bob Dannenhoffer. I'm the Public Health Officer for Douglas County in Oregon, and this is another of our COVID conversations. So this is a chance for us to tell you what's going on in the world of COVID and to answer questions that people have had and brought to us in the last week. Again, if you have questions for us in the future, please let us know at Facebook questions at douglaspublichealthnetwork.org, and we'll get to them at our next session. So in the world, COVID is pretty flat. The BA.5 variant, which is spread pretty much all around the world, is continuing to spread, but we are not really seeing a lot of new variants. So you'll remember that we started with the Alpha, and then we had the Delta, and then we had Omicron, and then Omicron went BA.1 to BA.2 to BA.5. But interestingly, we're seeing some subvariants of BA.5, but not really much new after BA.5. And with that, the disease is kind of petering out. Still not gone, still lots of disease and lots of death around the world, but certainly better than it was before. So when we look at the world, there's still a fair amount of disease in Asia. So Japan, Hong Kong, Taiwan are having a fair amount of disease, and Australia and New Zealand, which did not have a lot of disease in the beginning part of the pandemic, is starting to see more disease. But it's pretty quiet in China, pretty quiet in India, and pretty quiet in Africa. Now, Africa is always a hard area to know. Africa has, in many cases, presaged problems otherwhere in the world, but it's been very quiet right now, especially in South Africa, which has got a very good surveillance system. So that's good news that the disease seems to be quiet in those areas, but still pretty active in South America. South America has really had the worst time with COVID of anywhere in the world, and South America continues to have a lot of cases. In the US, it looks like cases are probably peaked and maybe starting to come down, although deaths and hospitalizations are up in the US. When we look at a US map, there's a fair amount of heat. Well, that means more disease in places like Kentucky and other places in the South, but there's no real hotspots in the US. In Oregon, cases look like they've peaked. Looks like hospitalizations have peaked, but Douglas County is sort of the end of the trail here. So we know that more rural counties tend to peak a little bit later. And indeed, it looks like we're peaking a little bit later than the state. We still have a fair amount of disease. We're still seeing 50 or so cases a day. And hospitalizations are up in the high teens, which is higher than it's been before. And unfortunately, we've had 6 deaths in the last 10 days or so. Those deaths have been mostly among older people who were neither vaccinated, never had the disease before. So they had no experience with COVID and no immunity. And when they got the disease and they got sick, they spent a fair amount of time in the hospital and then died. So what we are seeing is that people who have some immunity either through vaccine or from infection seem to do much better. People who have been vaccinated and boosted and double boosted seem to have the least trouble with this. So we are seeing a real protective effect from vaccination. We're seeing some protective effect from having had the disease before. So still, it's not too late to go ahead and get a vaccine. There are a couple of new developments over this next week. One of the new developments is that the Novavax vaccine has arrived. Novavax is a vaccine that's provided in the traditional way that we've developed other kinds of vaccines in the past, like the vaccine for shingles or the vaccine for tetanus. It does not use the RNA technology and seems to be really quite safe and quite effective. So if you were interested in getting the vaccine, but didn't want to go with the Moderna or the Pfizer that use this RNA technology, this does not have the RNA technology, and you can use it and use it safely. So if you're interested in getting the Novavax vaccine, it's widely available in town. Give your doctor a call and we can go ahead and get it for you. The second part that's interesting and new is that they say we're going to have a booster come this fall. They say it's going to be in the middle of September. And to me, that seems way, way, way more optimistic than I would be. But they're saying by September, October, November, we'll have a booster. And that this booster will have the original virus in it, or the ancestral strain, but will also contain the Omicron BA.5 strain, which is really what's circulating now. And that could really help us to prevent from having a big wave this fall. The logistics of this we're not exactly sure about, but if this vaccine is there, if the vaccine is available, we'll be sure in Douglas County that there'll be multiple places to go ahead and get that vaccine to keep you safe this fall. The other news that's out is that there's still plenty of oral antiviral treatments. The oral Paxlovid or Paxlovid is available. It really does seem to prevent hospitalizations. There has been some talk, though, about people having testing positive for a while after they get the Paxlovid, and that does seem to be a thing. It seemed to happen with the president. It seemed to happen with Fauci when they got it, but neither were particularly sick, either with the disease, and certainly none required hospitalization, and there were no deaths. So overall, I think we're doing a little bit better with COVID. I would expect in Douglas County, we're going to probably peak in the next week or two, and then the number of cases then will continue to decline. However, what the next variant is, not sure, and whether we'll have a fall peak again, not sure. But if we do have a booster coming September, October, November, strongly recommend that people get that. The other big stuff that's happening in public health this week is with monkeypox. Monkeypox continues to spread, although it's slowed down a little bit. Monkeypox is an orthopox virus. It's a virus in the same family as smallpox. It's been around for a long time. We've known about it since the 50s, but generally has not spread very much. It then started to spread in the spring of this year, spread to Europe, and now is spread across the country. Most of the spread is in men. Most of those men are men who have sex with men, and most of those people have had multiple sexual partners. So what we're seeing is that this is spreading in a way that some of the other sexually transmitted diseases spread. It is not only a sexually transmitted disease, although currently now we're seeing it's mostly spread in sexual activity. It's a disease. You start first with some fever. A few days later, starting getting a rash on the face and the mouth, and then a rash that spreads to the rest of the body. Not been a lot of deaths. There have been some hospitalizations due to the pain and discomfort of this, but we're worried that it's going to get established in the community. That is, it's going to spread around, and once it's spread around, it's going to be really hard to stop. So we're asking providers to be on the lookout for this disease should it occur. We're asking people who may have had exposure to let us know, because if you get a vaccine soon after exposure, you can prevent you from getting the disease. And there's a treatment for the disease. So if people get the disease and are sick with the disease, there's a kind of antiviral medicine that works for this. So monkeypox, we do not think is going to be a big risk for the general population. But if you're in one of those high-risk groups where you have multiple sexual partners or men who have sex with men, to be really on the lookout for this disease, because we do have ways to control it, but we can only control it if we know about it. The other public health stuff that's coming is I'm seeing more and more fires and more degraded air quality. The air quality still in Douglas County has been pretty good, but there's big fires up in the Umpqua National Forest, and we're worried that smoke is going to come to us. Again, when it's smoky, we especially worry for people who have lungs at risk, and people who have lungs at risk are babies, because they breathe fast and breathe hard. People with underlying lung disease like asthma or COPD, and older people, our lungs just don't work as well as we get older. We're asking people in those areas here to have a plan of what to do if it gets smoky. And there are a couple of things you can do. If it's easier for you to move to a place that doesn't have smoke, like the coast, that's a great option. If you do need to stay here in town, to have a way to live in your house with the windows closed. Again, windows open allows that smoke to come in. And if there is smoke in your house, but have air filters, you can purchase air filters or make air filters. If you look on our website, we have a little video on how to make an air filter to go ahead and decrease the smoke that you'll be exposed to. And then the last is extreme heat. We had a lot of heat last week. Thank goodness we had no deaths in Douglas County from the heat, but there were some deaths in other places in the state. So we especially worry about people who are homebound and people who do not have air conditioning. So if you're in one of those situations, there are things you can do. We had a cooling center last week, and then evaporative cooling is also very effective. So evaporative cooling means that if you have it in an area where it's hot and dry, this does not work in areas that are hot and humid. But thank goodness in Douglas County, when it's hot, it's also usually dry. So evaporative cooling will work. So a wet washcloth to the face, Gets a little bit of water on the face. When that water evaporates, it really cools things down. So we really like evaporative cooling. The misters that people use also work to go ahead and decrease the air temperature. So there are a lot of options for people to avoid the heat. So there's always stuff to think about in public health. But this week, we're worried about heat, smoke, monkeypox, and above all, COVID. So again, our best advice for people is if you're not vaccinated, please consider getting vaccinated. If you've been worried about the mRNA vaccines, get the Novavax. If you are sick, stay home and get tested. If you do test positive, you should talk to your doctor about using one of the oral antiviral medications. We think for older people or people otherwise at high risk that those medications really can prevent hospitalizations. So that's where we are today. If you have questions, please send them to us. You can send them to us at Facebook questions at DouglasPublicHealthNetwork.org. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County. Thank you.